Devona, shall we start? Okay. Well, welcome to tonight's program on improving your digestion and improving your health. This is really one of my favorite topics to talk about, as I'll get into a little bit later, because it's the beginning point. It's where health actually begins. And I always appreciate talking to the groups that come here to Tahoma Clinic, because I know every one of you have been working on your health. You're aware, you've been researching things, you want to get better, you know about holistic or at least green medicine. And so it's always fun, and I do welcome your questions during the discussion. So, which one do I click? Devona, okay, there we go. I always have to advance the slide. So I want to start with the basics here, which we all know. We are what we eat, right? And that's the blessing and that's the curse. What we eat doesn't always seem to agree with us. So generally, and this is what all of our doctors talk about here, is having a variety of healthy diets that you can choose from the paleo diet. You might also think of that as the caveman's diet. The Mediterranean diet, think about the, Italian, French kinds of cuisine, where you have a variety of fruits and vegetables, healthy oils as part of the cuisine, to vegetarian and vegan diets. We like to emphasize here a healthy intake of organic fruits and vegetables, free range and wild caught, free range organic meats, turkey, bison or beef, and wild-caught fish. And then when things aren't going as well as you might expect or hope, then we add in supplements. But ideally, what we want to do is essentially, focus on what we're eating. And this is not exactly a new concept. Quite a few years ago, Hippocrates actually stated, "Let thy food be thy medicine, and thy medicine be thy food." He had the idea well before holistic medicine did. But then, what do we do when what we eat isn't working for us, or we're having problems with that, and we can't enjoy our food, or we do enjoy it, and later we regret it? So I tell this to many patients, this last concept, that the knee bone is connected to the thigh bone. Everything with regarding digestion affects everything else, every other aspect of our health. So I'd like to take a moment here, and this is your opportunity to basically, did anybody come in here with an idea or a question they wanted me to address? I will try and incorporate it if I don't already have it in the notes, but by virtue of us being a collective group of people that are not looking at specifically one thing, there can be many different ideas that you might want to have covered. So did anyone have any questions? Yes, ma'am.
I'm having a lot of problems with reflux, and I've already tried probiotics and enzymes and even the reflection thing, and I'm not getting anywhere.
So the question, and I'm not going to address them right now, but I'll just say the topic that came up is reflux that isn't working very well with probiotics or other supplements. Anyone else with a problem that they had in mind? Yes, ma'am.
Inflammation.
So the comment was inflammation. In what type of inflammation?
Joints.
So joints, as it pertains to digestion?
Probably.
Okay. So the question was inflammation as it pertains to joints and how digestion might impact that. Was there another? Yes, ma'am.
I was thinking about gas.
Okay.
And I know which foods cause it, but the probably some extras, but how to handle it calmly.
Okay. So that's a good one. All of these are good, by the way. The question was about gas and how to handle it. She knows the foods that contribute to it, but then what to do about it when it occurs, despite what you know. And that's the case, isn't it? It's despite what we know. We eat something and against all odds, it's unpleasant, or we don't like the effects that it creates. Anyone else come in with an idea or a thought or a question you want me to cover? this is your opportunity to at least help me incorporate it. So, yes, sir.
Maybe something about hiccup.
Hiccups, okay. So, so the comment was something about hiccups and what contributes to that. Okay. Yes, ma'am.
And how about fiber? I mean, how much fiber should we be eating?
Okay, and that was about fiber, how much to eat. Sometimes some of these things are not how much, but basically what are the conditions contributing to us needing or wanting to do that very thing. So I'll get into some of that a little bit later. Anyone else? Yes, ma'am. So is malabsorption, and did I hear that correctly, IV therapy? IV therapy, particular types you're thinking of? I mean, okay. So specific. So she's mentioning amino acids, some of the type of IV therapies that we might use to help replete somebody who's deficient due to malabsorption of nutrients. Or alternatives, okay. Okay, so yes, I can, let me move on from here, but these are all really excellent questions. So, so some of you already mentioned some of the things that come up when we can't absorb well what we eat. And many of the things that everyone mentioned here have to do with malabsorption of nutrients. Sometimes this becomes worse as we age for a variety of reasons. Sometimes it's something that we're born with and have to work with all of our lives. Most of the time in patients that I see, though, I'm seeing people developing these things over time. Heartburn, reflux. Probably everyone's had a little bit of that to some degree, but it can be so bad in some cases that people have trouble eating, have trouble functioning, even have trouble sleeping at night. Food allergies. Food allergies affect our digestion, and I don't think, well, let me put it this way. We have access to a lot of different foods. Food is plentiful, and I don't think we truly take into account the degree to which food allergies contribute to some of these digestive complaints. But other signs of malabsorption or inability to absorb what we're eating, and I hear this from people every day, cracked nails, osteopenia, osteoporosis is related to low bone density, even bad breath can signal that you're having a digestive problem. H. pylori is a bacteria that is associated with low stomach acid. Low stomach acid can directly affect your ability to absorb nutrients. And even using things like ibuprofen, NSAIDs, things that are anti-inflammatory, even aspirin, can irritate the gut and lead to things that compromise the mucosal barrier of the stomach and intestines, but contribute to ulcers. So a lot of things that are very benign in certain circumstances can be very detrimental. So I wanted to cover what digestion was. I know we eat every day, and we know what digestion is in most, basically we know. But digestion begins in the brain, or what we call the cephalic phase. We think about food, we begin to salivate, we want to eat, and I hope I don't make anyone hungry by talking about it here. But digestion begins with what we see, what we smell, what happens with our salivary glands. And then it begins to stimulate a reaction in the rest of the body and then release the proteins and the enzymes that we need to digest nutrients. And we have this, I would call it almost miraculous lining of the stomach that protects us from digesting ourselves. Quite literally, it's a wonderful barrier that when it's intact doesn't allow us to, it doesn't break down. So I'm going to take this in a couple of phases. The role of the stomach acid the role of bile and digestive enzymes, and then absorption of nutrients, and then, of course, elimination. It's going to be a tiny bit technical. Obviously, we're talking about this system. You know, and literally when we're talking about the digestive tract, we're talking about all the way from the mouth down through all the way to the rectum. And it's a very, very long a digestive tract. And all of it, this is what's ironic, all of it is outside of the body. So interestingly enough, the skin that lines that is on our arms, our legs, is the same skin that also lines the intestines as well. So, and some of the things that help the skin externally can help you internally also. So think about it as outside the body, but we still think of it as internally, obviously, because it's us. So, and I want to clarify, this will come up in a later slide. When I'm talking about pH, when I'm talking about acidity, I'm talking about something very necessary for digestion. There's a lot of confusion out there between alkalinity and acidity. We know that there's a lot of discussion about acidity and cancer, or acidity being detrimental for certain kinds of conditions or can increase urinary tract infections, those kinds of things. We need acid in the stomach to digest our food, to break down enzymes, to break down protein bonds. We need the enzymes to function at a particular pH. If we don't have that, you actually can't digest and absorb nutrients. And this is one of the problems out there. This is, this has come up in a different slide, where conventional medicine has it wrong in many cases. Most of the time when we talk about high stomach acid, low stomach acid, some of the problems associated with it, and people getting put on acid blockers, they have it backwards. It's actually too little stomach acid that leads to problems, not too much. So suppression of stomach acid can be a big problem, and I'll show you later on. That's why I want you to understand how digestion works. So as we're seeing food, we're getting ready to digest food, things are arriving in the stomach, and it stimulates the production of pepsin and hydrochloric acid. Now, I wrote on here a low pH, and let me click forward here. I wrote on here that a low pH inhibits gastrin secretion. What I mean by that, it's a feed-forward system. So as we get enough stomach acid in there, it'll shut down when it gets low enough for digestion to occur. So after that happens, the stomach will actually digest protein. It starts to break down the protein bonds of any type of protein. So we're talking meats, we're talking chicken, seafood, plant protein, whatever. It starts to break it down, and then it makes it ready for the next stage. So the next stage is actually when digestive enzymes are released, and I didn't write it in here, but I should have said this here at this point, that the digestive enzymes are released from the pancreas, and also at the same time the release of sodium bicarb. I guess I did say that way. And then that's at a higher pH. So you started at a very low pH of the stomach, like a 2 or a 3. If you know anything about acids, it's a very strong acid. That's why the mucosa of the stomach is remarkable, that it doesn't break down. But it does break down in certain circumstances. And then as the digestive enzymes are released from the pancreas it releases bicarb. It's sodium bicarb that we know. What it does is it raises the pH of the stomach so that the digestive enzymes can work. And they begin by breaking the nutrients down even further. And then that then stimulates the release of bile from the gallbladder to digest fats. So all of this has to happen for good digestion to occur. And then as it goes into the intestinal phase, then the nutrients are absorbed through the various stages through the intestines where they're appropriate for absorption. Any questions on that so far? I hope that hasn't been confusing. Yes, sir?
When you say low pH, that means an acidic state.
Yes, low pH means an acidic state, correct. And when I speak about a higher pH, I'm speaking as it becomes gradually more neutral or more alkaline. It can still be acidic, but it's moving toward an alkaline stage, yes. Yes, yes, ma'am.
My grandmother always said you should chew your food 20 times because she kind of indicated some of our digestion even starts in our mouth.
So the comment is a great one. She said, was it grandmother or mother, said you should chew your food at least 20 times because digestion begins in the mouth. It's absolutely correct. The word for it is what Fletcherize, right? You chew your food many times. And so that allows the saliva to begin to break down those protein bonds. And so you still need the stomach acid in order to break them down further, but that's an excellent point. There's another good point to that too, is that the longer you take to eat, the better for your digestion. And haven't we become a nation of fast food addicts? People eating fast. And one of the most common questions that I ask patients is how fast do you eat? Most people eat faster than 15 or 20 minutes. And do you know that it is the acid phase of digestion that takes about 20 minutes. So you have it, by the time you finish, you've gone through this whole process, and you haven't even gotten to the release of digestive enzymes or getting to the point of absorbing nutrients. So when you eat fast, you don't give your body time to use things appropriately. It works against you. And I realize, I know a lot of people that only have a half-hour break for lunch. They have to go somewhere, buy their lunch, or prepare their lunch and eat in 5 minutes. So a lot of what we do works against good digestion, and I think that has contributed to a lot of problems. Yes?
When you chew your food, there's that perhaps something that makes you then go out and go. And I was wondering, is that within the 20 minutes you're saying we do
Okay.
or longer? What makes that work? Because I am becoming aware of that in myself and thinking, oh, it works. I don't know.
It's a good comment. It's a good question. I heard it over here too. Somebody said it as you were saying it. It's peristalsis. And so she's speaking of peristalsis and becoming more aware of how it works within digestion. And that's important. That's an important point because peristalsis actually is the movement of things through the intestines. So it's actually a pulsatile action that occurs. Interestingly enough, there are people that actually don't have that very well, or it isn't working, that muscular contraction isn't occurring, or it's become very slow or inoperative. And in some cases, that's called gastroparesis. In essence, it's a paralysis of the gastric muscle. It's not working in the right way. So that can be a problem with digestion as well. So let me go on to the next phase here. Did I just click through one? I've clicked
Yeah,
through
you
two.
did.
Sorry about that. I can't go backwards. So what I'll do is I'll talk about the release of bile and the pancreatic enzymes here. So I mentioned that as part of the digestive phase. It's done at a pH that's more alkaline than when the hydrochloric acid is being released. And that's important because the digestive enzymes are neutralized or inactivated if you add them in when the stomach acid should be strong. And that's a mistake a lot of people make, is taking things at the wrong time, and I'll cover that in a little bit. And so this further breaks down nutrients for absorption, and then they pass into the small and large intestines. And anything that we can't break down easily, and there are certain forms of non-soluble fiber, then they're broken down and excreted. So now I'm at acidity versus alkalinity, and I mentioned this, is that everything becomes more alkaline as we begin to digest. As things go through the digestive tract, we're having the digestive enzymes come to play, the bile is being secreted, and then things are moving into the intestines. Yes, ma'am.
On average, how long does food stay in the stomach?
So the question is, how long does food stay in the stomach on average? Most times when we're talking about taking things away from food, we're often talking about an hour or so, depending. So some supplements I give people say an hour after eating, an hour before eating. That's not hard and true. There can be times when that isn't true, but generally we look at this phase of digestion as taking about an hour. So here's how I look at it when I'm talking with people. The first 20 minutes in which you start to eat is when you're actually, the stomach acid is coming to play, breaking down the protein bonds, breaking down nutrients. And there are probably 20 different minerals and vitamins that need enough acid to break them down. And so if you don't have enough in your digestive tract or being produced, then you can't break them down. One of the most important is calcium. So having too little stomach acid is a cause of leading to osteopenia and osteoporosis. And also, too little stomach acid can lead to immune function issues. People can be sick more, have more cases of sinusitis, develop bronchitis, and pneumonia, because this system, even though it's open, we're feeding food in, we don't realize it's also a closed system that involves the sinuses and the entire digestive tract. So stomach acid serves like Clorox of your body. It kills bacteria. It kills things that get into the system. So if stomach acid is too low, I don't mean low pH, there's too little stomach acid, that can lead to problems with your immune function. Then after about 20 minutes, then things pass into the next phase where the digestive enzymes are released. That's approximately 20 to 40 minutes. So when I'm asking people about taking things like digestive enzymes, I'm asking them how quickly do you eat, and that helps me to help them time when to take things. So your body is basically breaking down nutrients with digestive enzymes for up to 40 minutes. So you can see that if you're eating in 15 minutes, you're shortchanging the rest of the process. And so by allowing the digestive enzymes to break down nutrients, then you're getting the optimal absorption in the intestines. And there is absorption of nutrients all the way out even into the colon. Things are being absorbed and resorbed. And so it's such a simple process, something we do every day, but very complex. And when it goes wrong, it can go very wrong. So any questions on these phases? Yes, ma'am.
Beginning of the meal, you would take the hypochlorite acid tablet, if that's your need, and then wait 20 minutes to take the digestive enzyme.
So the question, a little bit ahead of where we are at this point, but I will say that what she's referring to is when to take things. And the answer is yes. There's an appropriate time to take stomach acid if that's what you're being given, and an appropriate time to take digestive enzymes. So I'll get to that in a little bit. But yes, that's true. Yes, ma'am.
Is there an average transit time from when you take food in until you get rid of it from your body?
So the question is there an average transit time to when you take food in and to when it's excreted? And that can vary. It can vary tremendously. I know there's a lot of a misconception out there that we eat and then we excrete it right away that day. But I don't know if any of you have, and hopefully you haven't, had food poisoning. This is a good way to show you that we don't just eat and excrete all in the same day. If you actually get so sick that you're vomiting and having diarrhea to the point that it's extreme, you can completely discharge your entire bowel contents. But what you will find is that it takes a time to recharge it. And so sometimes you have to eat, and even if it hasn't been typical for you, you can get to the point of constipation until your body recharges. So we don't typically excrete everything that we eat every day. I would say there's probably from 12 to 24 hours later that things go out, but you can time it for yourself. And if you want to know, eat something specific. either something red or something blue, like a blueberry, something that'll color the fecal matter. And see how long for yourself it takes to show up. So again, it's probably not going to be in 6 hours, but it might be the next morning. So the transit time is probably longer than we imagine it. It's also going to depend on your own intake of fiber, your own use of probiotics, your own typical transit times, your own basic metabolic rate. It's going to depend on you individually. Rapid transit time is usually what we would associate with something like diarrhea. And slow transit time, meaning something like several days, we would more associate with constipation. So optimal is somewhere in between for each individual. Yes?
I've heard that's a good way to check.
So the comment is eating corn is a good way to check the transit time, and it is corn or things that are harder to digest or insoluble fiber. Yeah, corn is really hard for most people to break down. Nuts sometimes are hard, things like that. But if you want to check it, that might be your homework to see what your transit time is. Yes, ma'am. Beets, okay. So the comment was using beets. So we have a lot of different ideas that people have on that. But see what it is for yourself. But just knowing that on average, even if somebody has a bowel movement a couple of times a day, that may not be that they're eliminating everything from that same day, but maybe from the day before. It depends on you individually. It's really quite a misconception. I hear it every day. But it isn't like stuff is sitting around there from decades ago. It doesn't happen. Things are moving through. We're not really building up a lot of things that are sitting there and not eliminating, all the fecal matter. Now, you can have different other kinds of problems. You can have diverticula, which are pouches that people can develop essentially that create problems and cause diverticulosis. That is a problem. There can be other situations that can contribute to a slower transit time. But for the most part, we're not, having food sit around for decades. Yes, sir.
I don't know if this is appropriate, but if somebody had diverticulitis, something they could do for that, food-wise and stuff like that to help and maybe improve upon.
So the question is about if you have diverticulitis, what things can you do to improve upon it? There are a number of things, and I think some of the things that I cover will be appropriate for that too. Part of the problem is essentially things get trapped in pockets as they're going through. They get trapped in the diverticular, which are pockets that develop off of the colon itself, and so essentially it can lead to inflammation and it can lead to problems and quite serious problems. So managing the diet, managing the intake, appropriate use of different kinds of supplements can help manage that particular situation. But if you were to get into a state where it was serious, then I would call that a medical emergency. So there are times that appropriate treatment is needed in that particular case if it gets into the inflammatory state. Does that make sense?
Yeah, I know somebody has it, I was just curious.
Okay. Yes, ma'am.
I had heard that you have to have those colon, wash it out type of thing because you have stuff stuck to your colon and you need to wash it out. But I'm hearing that perhaps.
So the comment was she'd heard that we have to have things washed out because things stick. For the most part, they don't. I'll give you an example. When we're talking about, let's say somebody's going in for a colonoscopy, and the gastroenterologist wants you to clear things out. What they want you to do is clear that whole length of the colon. They want good bowel cleansing. It doesn't mean that that's been there for 20 years. That means that there's quite a lot of material that we have in the colon that's part of this recharge, that's part of this huge length of colon and intestine. So what they want to do is clear it out so they can see. and I'm not trying to say that what is the word I'm searching for? That you.
It's impacted.
Yeah. Essentially, I don't see that that's the case in most people. So I'm not saying no, you can't have things cleared out, but I'm saying that I would direct that at a different purpose, for tonifying, for improving health, for eliminating toxins. That I wouldn't say necessarily that that's the reason, that a lot of impacted stuff in there is the reason to clear it out. There are good reasons why those are appropriate, but I would say that it isn't because we've got 20 years of buildup in the digestive tract. So how does poor digestion affect your health? And yes, sir.
What is acidity versus alkalinity?
Oh, I actually had said something about it earlier. Sorry. Let me address that briefly. So what it basically says is that you want an acid stomach. The stomach itself should have a low pH, which means acidic. So you don't want to make it alkaline. So if you talk about acidity versus alkalinity, you want a stomach acid that's a pH of about 2 or 3. So you need enough stomach acid to get to that level. And then as digestion progresses, then it becomes progressively more alkaline, to the point that as things are going out through the intestines and being excreted, then that should be more of an alkaline state, as opposed to acid at the beginning, because we need to be able to break down nutrients. If you don't have enough stomach acid, you can't break down calcium, you can't absorb a number of different nutrients, including vitamin B12. And so people that don't have any stomach acid can develop a condition called pernicious anemia, and they have to take B12 for life. So there are many states in which having too low of stomach acid can lead to major health problems. So that's why I speak of acidity versus alkalinity. So going out of the body, more alkaline is better, and more acid at the beginning of digestion. Does that make sense? Okay. Yes? So what I repeat about the minerals? Well, there are about 20 different minerals, don't ask me to name them all, that need a low pH, a strong stomach acid to break down. And so calcium happens to be one of those. So if somebody has a state of hypochlorhydria, which means low stomach acid, or achlorhydria, no stomach acid, they have trouble absorbing calcium. They have trouble absorbing vitamin B12, and various amounts of other vitamins and minerals also do not break down for absorption very well. So you can have this state, and people who know me, who have come in to see me, I say this all the time: if you don't have good digestion, you just have expensive urine, if you're taking supplements. So what we're talking about is improving the state of health. And I want to kind of go back here. I'll go through everything that people mentioned. So I'm talking a lot right now about malabsorption. That is the failure to absorb nutrients very well. Fiber is important in terms of that, because that can affect what the transit time through the intestines and out through the colon. Hiccups. A lot of people talk about hiccups as being more related to an acid-base imbalance that essentially occurs. That may not be directly related to digestion, but it could be related to there being an acid and base imbalance in the body. Gas and bloating, I see this all of the time, related oftentimes to a variety of things, but can be due to malabsorption of nutrients, can be related to low probiotics, it can be related to low amounts of fiber. Inflammation, what we're talking about, all of this is inflammation. Inflammation that affects, and you can see some of the conditions that are up on the screen: gallbladder, cancer, poor immune function, development of asthma, rheumatoid arthritis, which is an autoimmune state, other autoimmune conditions, even macular degeneration and bursitis are related to nutrient absorption. And then, of course, what was mentioned the first thing today, reflux. Reflux is one of the first signs of low stomach acid and malabsorption. So when I hear gas and bloating and reflux, my first question is to look at somebody's stomach acid to see what's going on with the levels there and to see what needs to be adjusted. Now there was an interesting question asked earlier, and what the lady asked me about ulcer. Ulcer is probably what I would consider one of the most extreme forms of a malabsorption state, because what it is a sign of gastritis, or essentially, and think with me on this one. Let's say we take a big balloon and we put a little bit of liquid and we swirl it around, but we don't cover the whole lining of this balloon. So anywhere there's a dry patch, that's gastritis. That's an area of irritation where this wonderful mucosal barrier is not covered by some form of liquid that lines it. So that's where, let's say the little bit of liquid we put in there is low stomach acid. That area that's dry is the area where it gets irritated because it doesn't have a covering. It doesn't have something that is protecting it. And so that can lead to ulceration, which is the most extreme form of low stomach acid. And on one of the protocols that I'm going to tell you some of the elements of it, I've essentially brought people from ulcer to a normal state of stomach, of their gastrointestinal mucosa by doing this protocol. So gastritis, you might hear it from your doctor, oh, you've got gastritis. Well, you got to think about what that is. That's irritation of the stomach lining. And when we're talking about gastric ulcer, that's where the ulcer will penetrate. And so it's a failure of the gastric mucosa that is occurring there. Does that make sense? So, but all these other things that you've mentioned lead up to and indicate some degree of malabsorption. So I'm going to talk about some of these more specifically. Yes, ma'am.
My question is, if you take a full aspirin every day, can that cause that irritation?
Okay, good question. Very good question. So she asked if you take a full aspirin, and by that I mean you mean not an 81 milligram, but you're talking a 325. So can a full aspirin cause an ulcer? Yeah, absolutely. And it will depend on how you take it. I see this in a lot of people. When you take an aspirin, and sometimes, there are reasons to take it, most importantly, to prevent certain cardiovascular states or stroke, you have to take any kind of NSAID, ibuprofen, aspirin, any of those things that can be irritating to the gastric lining, you have to take it with food. You cannot take it on an empty stomach. And I've seen people break through, though, with ulcer even despite taking it with food because they don't take enough. So it's very important to have something in the stomach itself if you're taking aspirin. Otherwise, it'll surely break down that stomach lining and then cause an ulcer. Yes, ma'am?
Just naturally, I've been taking an aspirin at night, and it's almost like, even though I'm never hungry at night, I feel hungry before I have to take that aspirin, so I always take something.
Okay. So what she's saying is it's natural for her to want to eat, and she takes that aspirin at night before bed. I'll just say this, and I'm not, kind of trying to argue with anything that any of your doctors may have said to do. Aspirin should be taken when it's indicated for thinning the blood, preventing other problems, usually in the presence of a problem like cardiovascular disease, like a previous stroke, like other things related to blood viscosity. No one should be just taking it preventively. Aspirin should be treated like a very dangerous drug. It should not be just taken like, like we're eating a bunch of celery. It can be a big problem, and it does cause a lot of gastrointestinal problems. So Yes, ma'am.
Can we thin our blood just by giving blood? Is that
Yeah.
a better way to do it?
Good question. Very, very good question here. It was, can we thin our blood just by donating blood? Not only is that a wonderful thing to do, but yes, it's estimated in some people a couple of times a year is enough to thin the blood. It depends. Of course, I'm not addressing your personal circumstance, but giving blood, taking fish oil. I'm purposely not going to tell amounts on some of these things because I don't know your individual circumstances. Taking certain other herbs and vitamins can also thin the blood. I'm not saying don't take an aspirin, but if somebody is taking a full aspirin and doesn't need to, cut back to the 81 milligrams because, and this was put to me very succinctly by a conventional doctor, the studies show that 81 is effective and taking more doesn't make it more effective. So there are reasons why they give it at higher doses, often for treating pain and other things, but you can get the same kind of antiplatelet aggregation from an 81 milligram tablet as you can from a 325, unless there's a good sound reason your doctor has given you. And I'm not telling you not to follow their advice. Just if you want to avoid gastrointestinal irritation, make sure to eat or have aspirin or even NSAIDs with food. We could go down that road a long time tonight if we. So food allergies, and I want to tie this in a little bit with gallbladder, because a lot of people come in with symptoms that look like malabsorption or maldigestion, and they are actually gallbladder symptoms. And here's how they're interrelated. The gallbladder is very. We all know what a gallbladder is, and it's actually a very useful organ. And it isn't true that taking it out is the solution in many cases. Sometimes that leads to other problems. But the gallbladder is actually affected or can be made not very functional in two ways, by low stomach acid and by food allergies. Those are the first things that we look at when we're trying to differentiate what is going on. Is this a digestive problem? Is this a gallbladder problem? And this is not new information. Dr. Wright wrote about this. He did some of the original research on it. Back into the 1940s, people were talking about low stomach acid and food allergies as a cause of gallbladder problems. And so food allergies are a bigger problem than we even know. Can lead to some of the symptoms that were brought up here: gas, bloating, and reflux. So when you're looking at this, you have to differentiate what is really going on. And this goes back to the inflammation. Is it inflammation, or is it something else that's going on, contributing to things like headaches, aches and pains, even rashes and hives? So, and food allergies are sometimes difficult to diagnose because it's not an immediate reaction like an anaphylactic reaction. Sometimes it can be separated by hours, days, or even weeks later. So that's why I bring it up here. Is something going on with digestion, or are you actually having a food allergy reaction? Any questions? Yes, ma'am.
On your list of conditions here, one of the things you show is cancer. How is cancer related to poor digestion?
How is cancer related? I knew that question was going to come up today. I just knew that it would come up. Cancer is something that I would call all-encompassing. And any time you have a situation where you're not absorbing nutrients, where you have something that's perhaps erosive to the stomach lining, what you do is you begin to irritate that area. So essentially, and how do I want to explain it? In certain Asian countries where they eat a lot of fermented foods, the incidence of stomach cancer is very high. So things that irritate the stomach that can then lead to another sequelae of events, another series of events. If you're not absorbing certain nutrients that are really essential, you can then develop a state where you're setting up a chain reaction to lead to cancer. So while I wouldn't say, you having reflux is cancer, it can lead to a state. And here's how reflux can actually lead to cancer, is when you have, the contents of the stomach coming up and affecting the esophagus, basically the tissue here, can lead to dysplastic changes in the tissue, leading to something like Barrett's esophagus, which is a cancer of the throat, or can even lead to throat cancer. And I'm going to tell you guys a sad story, and this is why sometimes you may think you have an understanding of your state, and you may not. And this is where talking with a doctor who might be able to work with you is very important. This was some years ago. I had a gentleman come in who said, I figured it out. I've had this reflux, and I figured it out. I got myself a slant board, and I use it every night, and now I don't have any reflux. But in looking at him, I just wasn't convinced that he was better. So I said, okay, let's do some tests. Let's look at this a little bit more closely. When I got his labs back, it was one of those instant, this is cancer. I mean, when you see a lab that looks like his, I think anyone in the room would go, this is pretty darn serious. What he'd done is he's overlooked his reflux symptoms and other symptoms that he had, and he actually had esophageal cancer. And so the reflux went away, but he was in a state where he was in a severe anemic state. And so we did what we could. I sent him off to other specialists to evaluate. But he ignored that symptom, treated himself, at dire consequences to himself as well. Now, I didn't think that this was a state where he wasn't recoverable, but he took the information very badly. And so, I'm not sure that he followed through on all those steps. So it's one of those states that, and it still makes me feel sad to this day, but at least we got him the information. So what I'm saying here is it might just be gas and bloating, it might just be reflux, or it could be something else. That's why for you all to come and ask these questions and seek additional information is very good. So anyway, I just share that with you to know what some of the limits are and how things can lead to cancer as well. Any questions on food allergies? I will tell you here, we assess food allergies primarily through blood. We have several different arrays that we use that evaluate 96 foods in each one of them, and I think with fairly good accuracy. What I see coming back most of the time in terms of food allergies is dairy and gluten sensitivity. Those are probably the top that I see in people that have symptoms.
Gluten and what? I didn't.
Gluten and dairy.
Dairy.
And now that I'm sitting on the irritable bowel syndrome, the studies show that irritable bowel syndrome is probably caused 70% of the time by dairy and gluten sensitivity. So, and it's very common. I have people coming in probably every day that have certain symptoms. The GI discomfort, often I'll see either diarrhea or constipation. It can be both in certain individuals depending on what they eat. So we assess for food allergies, we eliminate things from the diet, and oftentimes they improve. I would say not oftentimes, most of the time. Any questions on irritable bowel? And I want to differentiate here. I'm talking about irritable bowel syndrome. There's also irritable bowel disease, Crohn's and colitis. Many cases of Crohn's and colitis are also caused by gluten sensitivity. We see that a lot, and it depends on when you catch it in the diagnosis as to how well you can control that particular state. Yes, ma'am.
What kind of tests do you do to have the diagnosis of IBS?
So the question is what kinds of tests for IBS. So it depends who you go to. and what kinds of symptoms that a person is showing. What I generally will do, let's say, if somebody is coming in here and we want to just assess stomach acid, we'll have them do a pH test. We often will do other testing, food allergy. We'll look at their absorption of different nutrients. And as I mentioned, the food allergy testing. But we do a variety of other things to look at nutrient absorption. If you have further questions on assessment, and I have this toward the end, and questions as to a more serious nature, then I send people for imaging, looking at either doing endoscopy, colonoscopy. I have a gastroenterologist I work with a lot that I send people to. So it all depends on the level you are or where you are in the continuum of seriousness of symptoms, how long you've had those symptoms, how debilitating they are, for example, whether it's a state of chronic constipation or chronic diarrhea. So oftentimes we'll go through the initial phase of assessment and we'll see improvement so we don't have to go further on down. But if we don't get that kind of improvement, then I will keep going on down sort of this doing different stages of testing and evaluation. Does that, ma'am?
Yeah. Low stomach acid, we were talking about that quite a bit here.
Okay.
Is there something that people can take, I mean, aside from taking hydrochloric acid, I mean, that's more medicinal or more
Okay.
of a medicine or a prescription kind of thing, like maybe bitters, or then maybe drinking some, or having some vinegar or whatever? I mean, are
It's
there
a-
things that you can take that are pretty safe? You could,
Okay.
just take them with every other meal or something?
It's a very good point. What she's asking is in either with or instead of hydrochloric acid that I've been mentioning a lot, are there other things to do? I had a little bit of that more a little farther down, but let me just address that now. So there are certain groups of people that can end up using hydrochloric acid effectively, and I would say those that are either hypochlorhydric or achlorhydric, meaning they have little to no stomach acid. If somebody has enough stomach acid but has some of these problems, then things like Swedish bitters, and there are different kinds of bitters that people can take, lemon juice, vinegar, those can be used. Anything that you can swallow, though, is nowhere close to the pH of the stomach acid. So those would be used in, let's say, lesser states. Or if a person cannot tolerate hydrochloric acid, and there are some that can't, then we would use those instead as something you take at the beginning of the meal to aid digestion. So there are a whole variety of ways that you can approach it to improve digestion and improve stomach acid. Does that answer the question? Usually I have people, if it's stomach acid that you're taking, the HCl, you actually take it with a little bit of food right before. Since lemon juice and vinegar don't upset in the same way, or they won't irritate the stomach, yes, you can take it 20 minutes before, or you can even take it with the meal at the beginning of the meal. So you can take it in a variety of ways. Does that make sense? Yes, ma'am.
I had the allergy testing done, and I didn't come up with a problem with gluten, but there was another thing that was related to it called gliadin, and nobody explained to me the difference between gliadin and gluten.
So the comment was that she had testing done, wasn't sensitive to gluten at the time on the testing, but gliadin was there, and what was that? So in terms of allergies of any kind, especially food allergies, what we're sensitive to is proteins. So gluten and gliadin are the two proteins found in wheat that we're sensitive to.
There's two
There
different
are
ones
two,
in wheat.
exactly.
Oh.
It's just easier. People talk about gluten, but gliadin is also one of them. So on our testing panel, you will see all of the things like rye, spelt, wheat, gluten, gliadin that show up, as things that you can be positive to. But those are the two proteins.
But I came up positive with only the gliadin and not allergic to the gluten, and that's why I'm
So,
not clear
okay.
about the difference and what I might need to
Well,
avoid and what
so,
the problem is.
so what she's saying is she came up positive for the gliadin and not the gluten. It's still in the gluten-containing foods. It's still one of the proteins. So that tells me that you're alert, you have some sensitivity to wheat. But that's a topic for another day. So, any questions on what I've just said so far? Yes, ma'am.
I was just gonna add, with some food allergies, I developed some really weird ones when I was in the 50s. And they were to things like the skin of apples, melon, cantaloupe, things that I'd always eaten, and all of a sudden I couldn't eat anymore, so I stopped eating them until they came out with organic food,
Uh-huh.
and then discovered that my allergies had to do with all the sprays and stuff that they were putting on our food.
Yeah, very, very, very good comment. What she said was, and what I'm doing, everybody, the reason I'm repeating things is you can hear the comments, but this is for the recording. And so, so what she's saying is she developed some weird allergies of apples and different fruits in about her 50s or so, and it turned out to be due to pesticides and things that were being sprayed, and probably even some of the preservatives and things for transport in the fruits themselves. And I've also heard people describe the molds and other things that grow on things that are transported that people are sensitive to, and that when she switched to organic, things seem to improve. It brings up a really good point here, and I didn't include it here, but I want to say it, and I'll say it carefully, is that there's a lot of discussion these days about genetically modified foods. And there's a lot of effort on many levels to say, oh, it doesn't change anything, it doesn't affect anything. You know, why should it matter? It matters a lot. And a lot of the research has either been made difficult to do or squashed. And so there is actually a really significant study that came out, and the studies are in animals. It's hard to prove this in people, that shows basically that genetically modified foods do have gastrointestinal symptoms. And I actually had some of that show up in some patients who were eating corn that was not genetically modified, and when they switched to organic corn, those symptoms went away. So I can't prove it. I can only point to one study, you know, and I don't want to kind of deal with a politically controversial subject, but, you know, I would say many of us agree that genetically modified foods have their problems, and they show up in the digestion. Yes, ma'am.
So is that the Italian study?
The question is that the Italian study, was that done in pigs? Was that the one in pigs? I don't know. It's been a while since I looked at it. This was one done in pigs, that they showed that pigs fed genetically modified, and it was a perfect study that showed that gastrointestinal symptoms did exist. So, but I don't remember. I did the research on this a few years ago, so I'd have to go back and look. Yes, sir.
Can you say something about vinegar and lemon juice?
Yes, so the question is about vinegar and lemon juice. Because you can swallow it, it's nowhere close enough to the pH of the stomach acid, but you can use it to improve digestion.
Can you use them together?
You know, I've had people tell me they do, and I think there's a protocol out there that involves both of them. And you could, if that appeals to you, to use both. I find sometimes lemon juice and vinegar are very different tastes and maybe don't feel so good together, but I think the one protocol I saw, there was something that sort of sweetened it and it made it better. But you can use either or both. I usually suggest one or the other rather than both. But you would use that in a situation where you wanted to improve digestion, but you didn't either want to take betaine hydrochloric acid or you couldn't.
How does the body pH relate to intestinal pH? And the reason I'm doing vinegar and lemon juice is to make my pH, my body pH more neutral. And I don't really know, does that mean blood pH or does that mean, what is the pH of the body in general?
Well, the pH of the body is generally, so the question is what is the pH of the body and how does lemon juice and vinegar relate? In essence, are you taking lemon juice at a time different than when you're eating?
Yeah.
Okay,
Usually, do the vinegar and lemon juice before he
okay.
has a morning fast.
A lot of people do lemon juice and vinegar and that more as like a cleanse in the early part of the day. Very common to do that. We're talking about a different thing when we're talking about digestion because anything you can swallow, again, is a more neutral pH. So the body pH, it actually depends in many cases, but it's more neutral, about, let's say, a 7 or 7.0, 7.1 or 2. And then when we're talking stomach acid, we're talking about a 2. We're talking about alkaline, let's say fecal matter, urine, we're often talking a 7 or an 8. So if you get too high, too alkaline, we can talk about other problems that can occur. But so there's a vast range. The body is more neutral. So when we're using lemon juice and vinegar for alkaline purposes, it's a different purpose than for the digestion. It can aid in it, but it's a different purpose. So that's more you would measure alkalinity in the urine than. That would be, do you use any kind of pH strips or anything like that to test it?
Say that again.
There are pH strips that you can use to monitor the alkalinity of your urine to see where you are with that one. Different purpose here for digestion. So, yes, sir.
In reference to the bitters and the apple cider vinegar, whatever, I was informed that if you take that down and there's a bubbling in your stomach, it shows that your pH level isn't correct. It's like you just feel a bubbling going on in your stomach when it gets there.
So he was saying that when you take, let's say, the bitters or the lemon juice and vinegar, and there's a bubbling, it means the pH is not correct. I don't know that one very well. Tell me what you have been told that.
Well, I was talking to a guy with greenery in your area.
Uh-huh.
He's a dietitian technician or whatever. And I also read somewhere else that if your pH level isn't right in your stomach, when you take this, there's a bubbling effect. And as I started taking the hydrochloric acid and things like that, heard from you folks that I don't have that much of an effect with the bitters or the apple.
Okay. So and actually what you're saying does make sense, that once he did that, he did have some bubbling from it, but then when he started taking hydrochloric acid, that he no longer had that bubbling effect. Probably suggested that you needed something stronger for digestion purposes. So I'll look into that a little bit more, though, to look into the bubbling versus that and hydrochloric acid. So, yes, ma'am.
I heard that taking baking soda is protocol to use for better digestion because it makes the alkaline.
So, yes, the question was about using baking soda to improve digestion. I did actually, when I talked about the pancreas, so there's an appropriate time when baking soda should be, let's say, would be effective, but it isn't all the time. In fact, taking baking soda, it's a common remedy for let's say, reflux or indigestion, but too much of it can actually disrupt the system. So the only time we're really looking at neutralizing is in the second phase of digestion when the pancreas is releasing the bicarb. So I would only use a little bit of bicarb or baking soda, not a lot, because we don't want to neutralize the digestion.
So drinking a bubbly liquids, they have bicarbonated.
Oh, different.
Carbonated drinks, are those?
So drinking carbonated drinks, people do it all the time when they have sodas or tonic water or whatever. We're talking about a little bit different strategy here. I'm really talking about using baking soda. But you could surmise that too much of some kind of a carbonated liquid could upset the digestion. I'm speaking more of, and sometimes it is settling. If the stomach is upset, it is settling to it. It's because it does neutralize. But at the same time, when we're talking about actual digestion of nutrients, you don't want to do too much of that, with management of food intake.
I will just say a friend put it on for broccoli to keep it green, baking ended up having oxygen, her body was so, it was not good.
Yeah. So the comment was it wasn't good, and I would agree with you. Not too good to use too much of it, because the body manages certain things in finite amounts for particular reasons. So let's talk a little bit of gluten sensitivity here. So I don't want to get into it a lot. It's talked about a lot in many places. But gluten sensitivity, I'm talking the range from celiac to gluten sensitivity, can actually cause damage to the digestion itself, to the villi of the intestines. That's at the extreme of the celiac disease. But I've seen many people with gluten sensitivity have all of these symptoms, from fatigue to malabsorption to malnutrition. One of the first cases I ever had was a mysterious one to me. I saw that this individual had low levels of iron. She didn't have anemia, but her iron levels were low. And I did a lot more investigating. And it was interesting, as one of my earliest food allergy cases, not only did she have celiac disease, but everyone in her family did too and didn't know it. And so it led to a diagnosis for her son that actually improved his health. So gluten sensitivity can actually impair the absorption of certain other nutrients. And in the case of celiac disease, it can actually impair the absorption of iron. And so sometimes when you'll see this on testing, it's kind of a clue of go looking more for other undetected food allergies that can then lead to problems. So I didn't want to go too much into this, but just kind of point out to you the importance of food allergies in assessing digestive issues. So I wanted to this next part, because I go into some of the things that everybody has been kind of leading up to, which we're talking about first let me tell you how it goes wrong and why it's important to get it right. So when we were talking about stomach acid earlier, conventional medicine, you go in with reflux, gas, and bloating, maybe signs of an ulcer. They're going to tell you, we've got to get you on an acid blocker. And if you actually read about some of these, they were intended for short-term use, a couple of weeks at a time. They were never intended for people to be on for the rest of their lives. And as I said earlier, when we're lowering the stomach acid, we're raising the risk of so many other problems, including the malabsorption of nutrients, poor absorption of calcium, leading to osteoporosis. And one of the things I ask everybody when I do a review of systems, which was with every new patient, I ask them about some of these respiratory conditions. Have you had bronchitis? Have you had pneumonia? Two red flags for low stomach acid. And so because they allow in the bacteria and virus that actually lead to some of these problems. And so then I go searching for more. So I'm not saying you should never use it. I've even used a few protocols where I use it for a very short time with someone until we can move on to the next thing. But be very sure if somebody puts you on some of these that that's what you want to do for the particular reason. What we believe, and going back to the balloon again, and I don't even just believe it, I've seen it borne out in everyone I've ever tested, except for 2 people, is that it's almost always too low of stomach acid, not too high, leading to problems with reflux, gas, and bloating. It means there's not enough to break down the nutrients in your stomach, and you're getting fermentation. You're actually building up gas in the system. So I was asked one time, why does it work? If it isn't good to do, why does it work? Because it does reduce the symptoms. It just doesn't heal the stomach lining. It doesn't heal the mucosa that you need. And I'm going to take you to something that does. So how do we begin to assess for digestive problems? And we've talked about some of this. So one of the things we do, and there's only a couple of these in the country that are available, we actually test your stomach acid. We take a capsule, it's about the size of a calcium tablet, and it's on a string. We're going to pull it back out. We drop it down into the stomach, and then it sends readings over to a screen, And don't worry, I see faces. It's not painful. It's not, it doesn't cause a gag reflex. Even little kids can do it. And so we actually see the reading on a screen, and we can tell if your body's able to, if there's enough stomach acid to begin with. And then we do, kind of back to the baking soda, we do a baking soda challenge. So we add it in and see if you can return to an acidic environment. So we keep doing that until we know whether, yes, you've got normal stomach acid, low stomach acid, or no stomach acid. And that's called the Heidelberg test. Very, very useful in determining whether you need stomach acid or not. We also will do, sometimes that can't be done or people are at a distance, we'll also check amino acids. So your level of amino acids, kind of going back to protein, the building blocks are amino acids. We look at whether you can absorb those, and we do that through blood testing. As I mentioned, the food allergy testing, again, will show us indications of if there's anything affecting digestion. And then, and only then, after we pull all the facts together, then we determine whether you need to have stomach acid added in, almost always digestive enzymes, and almost always probiotics. That's kind of a quick overview. Yes?
Well, I have for a long time with my own testing and everything. Stomach, hydrochloric acid, all these things are actually made from amino acids, aren't they?
Mm-hmm.
So in other words, if you're not getting enough amino acids, which we normally get it from meat, but then of course if you haven't, if you might not have enough hydrochloric acid, you can't digest the meat. So then it becomes a vicious circle of you not getting amino acids. So I know here you can get amino acid powder. You can take amino acids in an absorbable way so that your body can start to manufacture your own enzymes and hydrochloric acid again.
And this is a good point she's mentioning about how you need amino acids. You also need certain other ions that are important for manufacturing the stomach acid as well, and the digestive enzymes. But she's speaking of how important it is to get amino acids in if you can't digest things like meats and other sources of protein. And the amino acids will then also bring you back to a good point. And there was a question earlier I want to address. Somebody asked about IV therapy, and that was for malabsorption. So we do actually do amino acid IVs here too, because sometimes when malabsorption is really extreme, you can't get it in, even doing, the finely graded amino acids. You can't get them in. So we'll often do amino acid IVs to bring people back to a good level. We'll do mineral IVs that will often help with repletion, and various other types of IVs that'll help bring people back. So it isn't like, how do I want to put it? If you weren't absorbing anything, you wouldn't be here. So I say that to people when they come in. Obviously, you're flesh and blood and functioning, but we're talking about a degree of improvement that we need to make for optimal health. And here's where we're going to. We're looking at your long-range survival, your longevity, and as we age, eliminating problems that come with malabsorption. So even though we know that low intake of certain nutrients affects osteopenia and osteoporosis, if we can catch it before those develop, we can prevent them. I would say mostly we can prevent them. At the point of osteoporosis, then it's a harder trick to reverse. So that's why improving digestion, improving the absorption of nutrients is really important. And so that's why stomach acid has come up here a lot. I don't want to minimize the importance of things like digestive enzymes, though. Yes, sir?
Everyone talks about probiotics, but I hardly hear anything about prebiotics, resistant starch and things like that. Could you talk about that?
Sure. So it's a good comment also. We talk about probiotics, but we don't talk a lot about prebiotics. I don't talk about prebiotics a lot because there are a lot of different sugars available in most people's diets that help with probiotics. So I don't add them in. I'm very careful with adding in fructo oligosaccharides, basically. So So I don't use them a lot, but I know in certain conditions, certain states, you would use them. So, but, yes, sir.
Well, the FOS aside, we also, the resistant starch,
Mhm.
you get from beans or potatoes that are cooked and let to get cold and stuff like that, that allows the bacteria to grow in
Mhm.
your gut.
Mhm.
Inulin, that's an FOS gas.
Yeah.
But I mean, those are things that are cheap for your diet, but it just, it helps your body make its own bacteria.
It's a good point. Yes, the idea that helps the body make its own bacteria. This is a good substrate. So at the appropriate times, we'll add them in. I would say I add them in less often because oftentimes we've gone over the diet and found things that are appropriate. But yes, it's a good substrate to use at appropriate times. I don't discount them. I just don't find I need to use them in many cases with what I'm doing. Yes, ma'am.
Before you move off the assessment and what
Yes.
methods that mentioned food allergy, blood work, thyroid testing, doesn't the Tahoma clinic also do a stool test?
Yeah,
That looks at how well the body is digesting proteins?
It's an excellent point, yeah. So she's pointing out that here through our lab, and many of the doctors in the clinic do use a stool test, and it's a very good point actually, where we look at. I would call that a little bit further down the ladder of assessment that I would do that, in terms of determining where the problem exists. But what the stool test looks at, it looks at dysbiotic bacteria, whether there's a good balance of beneficial bacteria, whether there's a dysbiotic or imbalance, are there pathogenic bacteria, are there bacteria, let's say, is there a yeast overgrowth? And then it looks at the pancreatic function, it looks at how the digestive enzymes are working, fatty acid absorption. And then if there is a problem in anything, it'll then give us a culture and sensitivity. For example, would it be better to treat with certain kinds of supplements, or would it be better to go to something like nystatin for yeast overgrowth, something like that? So it gives us a good perspective. The only thing, I don't use that as my first line of assessment if I'm suspecting things like reflux. I want to see what the stomach acid is, and then when we're looking at the overall impact of digestion, then I'll look at how effective it is at that point. Some of it comes in too. Some of what I'm talking about, we're talking about costs involved, so I also want to make sure that anything we're doing with people, we're sort of phasing things in as opposed to sticker shock on the first visit, that kind of thing. But we also will do the amino acid assessment, the comprehensive stool digestive analysis. There's something called the neutrophilic segmentation rate, another blood test that can give us a quick idea of things related to your absorption of things like folic acid that can give you a good idea of how you're absorbing certain things. So there are a variety of tests that we can use depending on how serious the malabsorption state is. And it may be that we might even jump to a gluten sensitivity stool test. We might look at bacterial overgrowth. And one thing that's really common these days to do more of is the breath test. So looking at things that we can assess breath through breath testing, we can look for H. pylori, but we can also look for small intestinal bowel overgrowth. So that's a breath test that is used. So there's a whole bunch of different strategies we can use to assess, or we establish that there's a degree of malabsorption, and then we go looking for how serious it is. And sometimes we start out with adding in stomach acid and digestive enzymes and probiotics, and then begin to refine from there. So there's a variety of ways to look at that. So I talked about what if stomach acid isn't the right strategy to do. And more often than not, when I assess that somebody has reflux or gas and bloating and we decide we're looking at a problem, sometimes what I'll actually do in this case is I'll add in things like, and I do this, it's called our gastric atrophy restoration protocol. And what this does is help heal the gastric lining of the stomach. So I use aloe vera or DGL, I should have written that out, is deglycerinized licorice. And we're talking the herbal form of licorice. I'm not talking about movie store licorice here, not candy. So all of these things have an ability to heal the stomach lining. So we'll start out with either aloe vera or the deglycerinized licorice, and then add in things like glutamine, zinc carnosine, vitamin A. I didn't write it down here, but vitamin A, and even chamomile tea helps with improving the stomach lining. And I will point out that over on the table, one of the things that we have some samples of the nature's lining, which is zinc carnosine. The way you take something like this is you take 1 tablet twice daily. So this, I think, is only enough for 1 meal. But zinc carnosine in this form is helpful for healing the gastric mucosa. Earlier on, we talked a little bit about minerals. There's also over there on the table some trace mineral drops that help with repleting of minerals. And I've tried these. They're not bad. Now, not everybody here is going to need anything with iron, but there's also a supplement, a Floradix. This is food-based iron supplementation, so herbal-based. So you can try that, but not everybody, especially as we get older, we don't need a lot more iron. Iron is a pro-oxidant, so I'd only recommend using iron if you actually need it. And I probably am not going to cover this much, although there is a natural calm powder, which is really pleasant. And if you have constipation, not diarrhea, but constipation, magnesium is really helpful for that. So those are all over there for you to sample, and I think there's maybe enough for everybody. Yes, ma'am. Okay.
Well, we drink a lot of water, and our water is fluoridated and chlorinated.
Yeah.
I'm not so concerned about fluoride, I get rid of that, but fluoridation I can't get rid of, and kind of wondering about that. And also then if you buy water that's RO water or something, reverse osmosis, and
Mhm.
all the minerals out of it, is that good too?
Yeah, okay. Good comments there about water. Water is a big topic. We could talk about that all night in a sense. But first of all, reverse osmosis. If minerals are all out, you need to add a trace mineral drop. I've had a lot of people come in who were doing that and they weren't adding trace minerals. You have to add the minerals back in when they're depleted, or distilled water, things like that. Fluoride, and chlorine, we're never going to get away from it when we're in an urban environment. There are a lot of problems. But if you have a question about the fluorine, any of the halogens, your bromine, iodine, fluorine, you can actually have a urinary halogen test done and then see where your levels are. And I've been surprised at some of the levels coming back from some people. One of the things that people don't realize is that iodine, which was added in to iodized salt because of the goiter belt, kind of the area around the Great Lakes. See, iodine gets blown in from the sea into the soil. And so in areas that are really far from the sea or been far from the sea for a long time in terms of geologic time, there's not very much in the soil for us to get. And so in the goiter belt, an area of low iodine, that's when they developed the iodized salt. But nobody's using iodized salt anymore. And in fact, they're not even putting it much in manufactured foods. What they're using to make bread fluffy and things like that is bromine. And so many people are low in iodine and high in bromine. And of course, because fluorine is everywhere, high in fluorine also. In fact, fluorine is added to so many different things. It's amazing to me. I did some of the research on some of the side effects of fluorine. So you might then consider a urinary halide test to see what your levels are if you're concerned about it. So this approach actually helps heal the stomach lining when we apply it. So
I was told by a doctor that I was allergic to the L-glutamine.
okay.
Is that, how can that be?
So she was told that she was allergic to L-glutamine. You can be allergic to anything in this world, truly. It's interesting. Glutamine is actually one of the most common amino acids. And it's actually the preferred food of the enterocytes, the cells that line the digestive tract. In fact, glutamine is used to heal the intestinal mucosa in patients that have cachexia. Let's say they've had chemotherapy and the gut lining is destroyed, or in HIV patients, they're often given high levels of L-glutamine. But, you know, I would say that maybe the exogenous use of it, the additional amount of glutamine, may not be favorable for you. So you could be allergic to anything, including your normal levels of things.
You have a test where you can have that validated, that opinion, you have a clue.
Well, that's a really good question. Do I have a test that can validate the L-glutamine? It's not something that's going to show up on our food allergy panel. The foods are going to show up there. I would say in that case that might be more something of a specialized array that you would want to have done, like let's say one of the specialty labs. I don't have per se a test that shows L-glutamine sensitivity. We can ask the lab about that, but I don't have one in mind right now. So now here's the part about optimizing nutrition. A lot of people come into me and think that not having a bowel movement for a week is normal, or that having diarrhea is normal. It's neither state is normal. You should have a bowel movement every day, or at least every other day. And if you're not, that's something to look into. And the reason is this: if you're having diarrhea constantly, and many people, one of the things I find in people that come to places like this, they are very religious about taking supplements, and sometimes you can get into this state where some of the additives can contribute to diarrhea. So I see that in many patients. Sometimes they're really into magnesium and taking a lot of magnesium, and that can contribute to diarrhea. So looking at causes of diarrhea, and this is where the stool analysis comes in really good, is to assess for bacterial balances there, to see whether there's anything dysbiotic that needs to be addressed or pathogenic. And that test, by the way, also looks for parasites. So parasites can be a common cause of diarrhea. But we'd want to look at that. But then constipation is also one of those states that shouldn't exist, and at least not on a regular basis. And oftentimes I'll see gas, bloating, constipation, reflux as a set of symptoms all at once in someone. And so that is to me a sign of malabsorption of nutrients. That's something to go looking for and to address, to get somebody back to a regular bowel movement. And part of the reason is the longer the stool sits there, remember everything as it's moving down all along the intestines and all the way out through the colon and out of the body, everything is being reabsorbed. So everything that your body is trying to get rid of is sitting there and being reabsorbed. And that can actually make people feel really sick and very toxic. So that's where certain of those things like why can't I think of the word, that help with elimination. That's where some of these
Laxatives.
No, not laxative. It's where, not enema. No, I'm sorry. It's the colonics. Yes, I haven't been able to remember. That's where colonics come in and can be helpful in tonifying and eliminating when somebody is not eliminating properly. That's where it's very useful. So that's why this is important. It's important from the moment you take in the food to the time you eliminate it. Yes, ma'am.
Can you stick to having enemas of coffee, enema of
Okay. She's asking about coffee enemas, and I think you're speaking of some of those cancer therapies that were recommended. I'm for the use of enemas on a limited basis, but I know I've had patients come in and they were using enemas every single day. And anytime you use a laxative, especially the strong cathartic laxatives like senna or some of those things intended to create a strong bowel movement, or enemas, what they're doing is they're impeding your own natural elimination. So the first thing that not only I would do, but a gastroenterologist would do, is get people to stop depending on those things, even too much in the way of colonics, to return the normal state of function to the digestive tract. I'm for in some cases, and in terms of specific uses, like as an anti-cancer therapy or as a anti-constipation type therapy. But you have to be careful of adding too many things in that then can make your own ability to eliminate weaker. Yes, sir.
Relaxing the colon, the gentian and Angostura bitters.
Mm-hmm.
We got my mother off of Purelax and lactulose within a week.
Wow.
When we switched her to taking bitters 20 minutes before each meal, and then eventually cut it down to less time per day. And I read numerous places that it helps restore the peristaltic action as well as help with absorption of B12, iron, and folic acid. Is that you?
It's an excellent example. Yes. So what he said basically is using bitters actually helped his mother get off some of the things that were that she had been put on that were impairing her ability to eliminate. The restored function, the restored peristalsis, and the ability to absorb nutrients.
Because they got her on drugs to slow it all down.
Yeah. Yeah.
And that's another problem is that these drugs that they give these
See, the stomach acid and the digestive system is actually a feed-forward system. So if you can add things in, it can tend to improve it. It's not a feedback. It's not a negative feedback loop. It's a feed-forward, meaning adding in stomach acid or adding things in that help improve the digestive function, then help improve that digestive function. And so anything we can do to eliminate the crutches and help support the natural function, that's in the direction of positive change. So a lot of good benefits there. So part of maintaining a good digestion is also to eliminate stresses. And I want to, this is going to come up in a minute, but I want to share a couple of different studies. These are kind of fun. I kind of went searching, and in a later slide it talks about students that were actually on they were studying low-fat diets, and what they wanted to do was see whether an occasional splurge of a milkshake and a ham and cheese sandwich would affect anything. And they actually did this in a state where the students were relaxed. They asked them to continue their diet, but every other day they could have a milkshake and a ham and cheese sandwich. And what they noticed, that it had no impact whatsoever on any of the lab values that they were getting. So, and I thought, well, I haven't looked at that in a while. Let me look up some other things related to milkshake. I wasn't thinking of having a milkshake, but so I found this interesting study that further goes along the line of relaxation versus stress and how our brain perceives things. Remember, parasympathetic is kind of that relaxed state, kind of like the lights are down, we're sitting there relaxed, we're not worried about anything. And stress is sympathetic dominance. That's when, we're anxious about things, maybe we're driving in traffic. Imagine the different times in terms of eating and what that does to how you absorb things. Well, in this particular study, they actually presented the participants two different types of milkshakes. They had one that they called a low-fat, low-sugar, more of a diet type of a milkshake, and they wrote on the cup that they gave them, they wrote that it was only 104 calories. Then they had another group that they called their indulgence milkshake. They said it was full of fat, full of sugar, and each cup was 620 calories. In truth, both were the same. They were both 300 calories. But when they gave the participants the 104 calorie milkshake, they found numbers consistent with 104 calories, even though it was actually 300 calories. So the participants believed that it was no sugar, low fat, 104 calories. This is interesting. It has implications in terms of weight, what we eat, what we do. And those that did the high indulgence milkshake, the 620 calories, that was supposedly full of fat, their numbers also reflected that and so their numbers shot up and in terms of the high indulgence response. So you know, so and in truth they were both the same. So I just thought it was very interesting what that does, how our belief system affects how we eat and how we digest and how we react. So if you think about developing a relaxed state in which you eat and absorb nutrients, just imagine how much better that would be. I'm really an advocate for slow eating, and I even did a talk in the past about the slow diet movement. So I want to talk here a little bit about continued ways to improve the digestion.
You know when
Yes, ma'am.
slow eating, your food's getting cold. And you don't want to eat cold food, so you hurry up and eat it while it's warm because it's getting cold and you don't like cold food. I mean, I've noticed that with me. I'm not one to really gobble, but if I've got something that's really good when it's hot and not really good when it's cold, then I'll eat it pretty quickly because I don't like cold food.
Yeah, the comment was that part of the reason to eat fast is so the food doesn't get cold. That's what microwaves or ovens are for. or imagine eating, I always do this, I think about sitting in Italy looking at a beautiful church or museum and how they eat there, and they bring you several plates spread out by hours between them. You know, so if you want to think about things that promote good digestion and relaxation, think about something like that. And then you can accommodate, instead of heating it and eating it fast, maybe spread it out into several different courses, things like that. Better thing to think about too, not everybody has this problem, but the more spread out your eating is, let's say the more small meals, the better for your blood sugar regulation also. So many different benefits. But I just wanted you all to think about the impact of what we believe on our digestion itself. I was going to bring this up at the beginning, but I want to mention this. An interesting study that I just read that says that your gut bacteria change whether you're a vegetarian or let's say an omnivore eating meats. So a meat-eating person that switches to a vegetarian diet will have a very different probiotic growth than someone that eats meats. And they said this transition happens very quickly, and some of it has to do with what these bacteria have to do. I'm not on a slide, sorry. So it has to do with what the gut bacteria have to do in terms of digestion. So I just thought that was interesting, interesting food for thought. Yeah, food for thought. So the question was, were they happy versus being vegetarian or not? Interestingly enough, there are many more bacteria associated with a meat eater than a plant eater. So in fact, far fewer probiotic bacteria. And so a lot of that had to do with what the bacteria had to do and process. So let me talk about this one. So after we've determined whether a stomach acid is a factor, food allergies, what other symptoms are developing, and then we've healed the gut, we might add in stomach acid. And I'm going to say might, so I'm not encouraging anybody here to go ahead and add in stomach acid, because you want to do it very carefully if you're going to add it in. Because if you don't need it, and there are times when somebody has low stomach acid and doesn't need it, it can cause burning and actually aggravate rather than help the situation.
That's true. I tried that. I paid for it.
Yeah, she's saying she tried it and paid for it. So anytime you're adding hydrochloric acid in, you want to make sure you have a few bites of food before you do, and then you want to watch for any burning sensation before you increase the amount you take. Digestive enzymes, and in my opinion, this is all digestive enzymes, I don't care what the label says, should actually be taking taken, if you eat slowly, it should be taken 20 to 30 minutes into the meal. If you eat fast, then just take them at the end of the meal because it's going to be sooner than 20 minutes anyway. Both of these will tend to improve digestion, help reduce inflammation. And essentially, I said some of the things earlier about slowing down and relaxing and having more meals. And I mentioned this one earlier. This one was about one of the milkshake studies. And that when they enjoyed what they were eating, they tended not to show as many of the side effects or problems with it. And I mentioned earlier, if there's a bigger problem, and I want to say sometimes there are bigger problems, you may need to be referred for endoscopy, colonoscopy, or even ultrasound. And I've sent people for all of these things. Oftentimes, basically, we'll do a nutrient assessment. There aren't a lot of good nutrient assessment blood tests out there. There's one called SpectraCell, very expensive, $400. And sometimes, it doesn't give me the information I want for quite a lot of money. So you can do individual assessment, let's say vitamin D. We can check individual nutrient levels to make sure and see how you're absorbing nutrients. Hair mineral analysis. I know there's a lot of information of pros and cons on hair mineral analysis. We use it a lot just to look for basic trends. I can get a hair mineral analysis, and if everything shows that it's on the low end of the spectrum, I know you're not absorbing nutrients very well. So it's a quick way of assessing where the problems are. I wouldn't use it to do any kind of chelation or heavy metal chelation with that. But if we suspect heavy metals are interfering here, then we would go to a chelation and a 6-hour urine collection. So I think that I have covered most of the things that I had on my list, and I know some of it rather quickly. And now, were there other questions I either didn't address or that came up in the process of the discussion? Yes, ma'am.
On the eyes, I had heard that your eyes are connected to your liver, something about if you're not, if there's something there that affects your eyes. It's just maybe all malnutrition.
So she's asking about eyes and the connection. We actually do a very specific protocol here called the macular degeneration protocol. And it's been Dr. Wright's premise for, I know, at least 27 years when he started this, maybe for forever. But he found a correlation between low absorption of nutrients and macular degeneration. And about 70% of people that do the protocol, which involves IV therapy and taking supplements and having all of the assessment I just covered done to assess to make sure there's malabsorption, about 70% of people that come through that 2-month program improve in their eyesight. So there is definitely something to it. I wouldn't know that I would isolate it just to the liver. I would call this more of a systemic issue. Yes, ma'am.
Sorry to finish about water. I meant to say nicotine water also.
Okay.
And the Japanese do a lot of work on the water.
Yes.
Anyway, I got a girlfriend, she says her parents had that kind of water, and, the plants that are around there, they're growing like, like weeds or whatever, so they get oxygenated, or like they get just whatever they need or whatever, so
Yes.
like people too, should we do water?
I wouldn't consider myself an expert in the types of water, but I like water that provides good levels of minerals, pH balanced, and I've heard good things about the Nikken water, for sure. But I don't know that we all belong on those waters. Some of it's expensive, some of it, I wonder about gimmicks. So I would say get on a good program with a good trace amount of minerals, good digestion, and you probably got your bases covered. So anyone else have any? Yes, I see a bunch. Yes, ma'am.
How do we detox from fluorine?
So the question is, how do we detox from fluorine? So the best way to do that is if you measure the urinary halides, then oftentimes what we do,